Go. All right, so welcome again. Today we'll be hearing some updates, some expectations, some procedures around COVID-19 as we approach the start of the next school year. There's a wide range of partners on the screen today. We have folks working with the city and DHSP. We have folks working with community-based nonprofits, housing authority, university affiliated. Our community is rich with different kinds of partners, and we really do seek to figure out ways to support everyone. Our young people, our families, our students, we really consider them to be shared. And we know so many of you have stepped up in the past 18 plus months to really support some of the highest need families and young people in person, hybrid and remote, but particularly in person, the partners who've been doing that. We really, really want to appreciate you. And we know that this year, there's some things that we're not able to predict, and we just are glad everybody to come together to share some information with you today, expectations as well. I'm going to hand it off in a moment to the operations office with Jim Maloney and Joanne Johnson heading that. And Joanne will be sharing some slides. Just a quick preview that similar to over the summer, for folks who are in school buildings over the summer, we will have an MOA or MOU that will be expected of all programs for your directors or your executive directors to sign. And we can do some of the follow-up work around that after this call. I'll be the point person to send those to, and Jim will explain some more about that during this Zoom. So you can also, I guess, put questions in the chat. We'll see what we can do around answering them or figuring out ways to answer them after the Zoom as appropriate. A couple more folks coming in. So without any further ado, I'm gonna, I think, hand it off to Jim Maloney, Chief Operating Officer for Cambridge Public Schools.
Thanks, Kari. Good morning, everybody. And I echo Kari's thoughts about the importance of your work and how fortunate all of us are here in Cambridge to have such a network to support families and children. It's just a tremendous thing that we have going for us. Today, we're going to go through a slide deck and then talk a little bit as well about an MOU that we're asking all of our partners to sign if we transport students to your program or if you're in our building, which is pretty much everybody. It's pretty harmless. It basically just states that you have read our safety manual and that you've shared it with your staff, and that you will commit to adhering to, at a minimum, you're also free to certainly put in more stringent protocols in your programs, but we want to make sure that you're at least following what we have going on here in the schools. I'm going to just take a second here. Anita Barando, who has replaced Tracy Rose Tynes. Tracy is now the Associate Director for Clinical Services and Public Health. She's moved up the ladder a little bit, and so has Anita. Anita and I and Joanne have been working closely together as a team pretty much since around the 1st of June. The phasing of the change of duties started to happen this spring. And Anita will be a critical partner for all of us in this. And before we get to the slide deck, I do want to say that we know how difficult it is for some of you. Some of you worked remotely all of last year, so this is your first time face-to-face with students, face-to-face with the opportunities to have to be in your buildings and be among children and staff. And we know that can be a little bit anxiety producing initially. We think, as you'll see in the slides, that our science and medical advisors, who include parents mostly, but they happen to be epidemiologists, medical doctors, and leaders in their field. Some of our epidemiologists that are advising us, you can regularly hear or read about on the New York Times or CNN, as they've all been deep in this process. So we took their input all of last year, starting over a year ago. and built a safety manual for the start of school year last year in October. We were a couple of weeks late in opening live. We updated it again during the year, and then we updated it again this summer, and we're actually going to update it again this week. So it's constantly changing. The guidance from our epidemiologists, from the Cambridge Public Health Department, from our medical advisors, and from the CDC. And we just want you to know that we will work with you. We had an interesting summer. I think this summer was an opportunity for us to see what things are like. We had 14 cases in Cambridge Public School buildings. That included some of their programs. Of those 14 cases, 12 were children, and the 2 adults were actually breakthrough cases, minor breakthrough cases, I'm told. So we know that we need to continue to be vigilant. And we're going to talk a little bit now about those slides. I don't know if Joanne has the slides or if Kari has them, but if you could put our slide deck up now, that'd be great. Okay, let's go to the, I don't think I can't control it from this angle, so we can go to keep rolling along with me. So we're going to talk a little bit about, this is a document that we've done for our principals. This is a document that we've done for our new employees. And this is a document that each of our principals is doing with all of their staff this week as the teachers and staff return to school tomorrow. It's broken into sort of 4 categories: roles and responsibilities, the key safety procedures that we have, what we're going to do with a suspected or a confirmed case, and the next steps. So if, who's moving this? Is Joanne running or is Kari running it? Joanne is, okay. So the first thing that we're going to talk a little bit about is the memorandum of understanding, which Kari mentioned to you. He will send that out to you after this meeting. We're going to ask you to look it over and sign it. If you have any issues with it, please let us know. We have some flexibility, but not a lot. It's been approved by the school committee. And I know we work to make sure it's compatible with just general safety protocols. We have a safety and facilities procedure manual that I just mentioned. That is online. We can send you a link to that with the MOU. You should read that, become acquainted with it. You should have your staff read it, so they also are aware of that. And again, these are at a minimum. We assume that some of you may have even more stringent protocols in place than we have. Next, please. Looks like I can move this, so maybe I'll do it. So as I mentioned a few seconds ago, we've had a fair amount of expertise in developing these things, and we will take their expertise and work with you throughout the year. We are going to be doing in our schools, we're going to be doing weekly testing for all students and staff. We have research defined, and we're now communicating our policies and protocols. What we have really is we've spent a lot of time on the ventilation and on personal protection equipment, masks, gloves if necessary, gowns if necessary, testing, and ventilation. Our scientists and our agreement in the past with the Cambridge Education Association, the Teachers Union, is that we will not use rooms that cannot achieve an air exchange rate of 4.0 per hour. That is an exchange of 4 fresh airs per hour, mitigated with recirculated, heavily filtered air. We have HEPA filters, and we know what open windows can do. And we're going to talk a little bit about that in a second. We are continuing to share all of our health information with our staff and our families. We're going to work to make sure that all are in compliance with the school and the after-school program. And we're going to continually try to coordinate all of that between all of us here at the schools and all of you who are our partners. If I could have the next one, please. So I think that the key to what we have going here is from day one. If somebody could mute their background, that'd be great. So we've learned from our experts, and really from the first days of this back in last May when we started to plan the reopening. That's May of 20, a year and a half ago. We have a layered approach, and it starts with behavior. And behavior, I mean following protocols, not behavior of that we often deal with in an environment where we deal with young students. Environment, and that's the building environment. PPE, which is our personal protective equipment, personal protection equipment. And then most importantly, vaccine. We want very much to spread the word and encourage all of you to get vaccinated. We know that world-class health experts are continuing to advise us on that. And we are going tonight, the superintendent of schools is going to announce that effective this fall, all non-union personnel will have to be vaccinated as a term of their continued employment. And we're about to start discussions for mandatory vaccination for all of our staff. How that impacts you at this time, I don't know. But we are going to be working in our buildings to make sure that all of the staff in our buildings who work for us are vaccinated. We have not yet gotten to the point of what that would look like for our outside partners, but we certainly wanted to encourage you all to get vaccinated. Next, please. Well, I just covered the next slide, so we can jump ahead to 8. So I think there are a number of, along with the vaccine, there are a number of sites that we would refer you to, and you'll have this deck is online, and Kari is recording it. So here's a half a dozen or 4 or 5 sites to that will address you. The most important thing we can do to any of you who are not vaccinated yet, or advise you, is to talk with your personal physician about that. Again, we here in Cambridge Public Schools, hopefully soon, will be all mandatorily required to be vaccinated. What you also know is that in our schools, and we certainly want this in all of our after-school programs that our children go to and we bus to, masks must be worn at all times, regardless of vaccination status. Outdoors, the masks are optional, in keeping with CDC and our own safety advisors. We know that outdoors, there is a considerably limited opportunity for the spread. Next, please. So if you do not require masks, as I said, we're going to reserve the right to suspend transportation to your services. Again, we can't encourage that enough. I think the state's guidelines now cover all of you, but we want that commitment from you as well. So once the programs start for the outside, I just got a very important text for anybody who's a football fan. The Patriots just cut Cam Newton, which is interesting. More to follow on that, but I guess I can't pay any attention to that right now. My son just texted me that. My son just texted me that and completely discombobulated my presentation. So outdoors, I know that we know that outdoors is the place to be for kids. When you're serving snacks, please do it outdoors. For us at our mealtime, outdoors is our default. We know from personal experience last year, we know in Cambridge Public Schools, and we also know from science all around the world with the COVID, that dining is one of the most frequently and most easily passed opportunities for the virus to spread. If the weather doesn't prohibit that, doesn't allow that or prohibits that, you can eat indoors. Students must be 3 feet apart and should all face in the same direction. It's not a time for running around and talking out loud. It should be a quiet, calm time. We also know, by the way, from our program this summer that of those 14 cases I spoke about, several of them happened when in good weather, we actually had people eating inside. And there were 2 or 3 cases in a classroom because of that. So we know it will add to the spread of it, and we really want to urge you to follow those rules very, very carefully, those protocols very, very carefully. And even when the students are just interacting with each other, outdoors is the place to be. So one of the things we learned, we ran a number of experiments last year on our buildings, and we spent close to $1 million on engineering studies and reviews. That continues as we speak. Right after this meeting, I'll be meeting with our facilities people about our latest engineering studies. One of the things we learned last year in working with our epidemiologists, we actually went out to our buildings and we conducted some experiments. That if you open up in a typical classroom, if you open up 2 windows, no more than 4 inches. 4 inches is the code under the state building safety code. You can't open windows with students in them more than 4 inches. But that alone, just opening 2 windows, 4 inches, will provide you with 2 of the needed 4 air exchangers that you have to have. In an older building, Cambridgeport, Amigos, the Longfellow building, most of those classrooms don't have direct ventilation, so they start out at 0. So you're going to need to have those windows open at a minimum of 4 inches. And by the way, we did it all last winter, including days when it was 6 and 7 degrees and snowing outside. There will be window fans in the classrooms that we have. Those fans should blow outwards, not inwards. All of our classrooms will have a HEPA filter. A HEPA filter is basically an air scrubber. A HEPA filter on high, the ones we have that were purchased for our buildings in place in one of our typically sized classrooms, which is anywhere from 850 to 950 square feet, will get you the equivalent of 2 air exchanges per hour. So if you have 2 windows open 4 inches and you have a HEPA filter that we're providing in our buildings running, you are getting the mandatory minimum air exchanges of 4. In most of our buildings, there are going to be additional air exchanges, certainly at the King Open, Morris, Haggerty, Peabody, Graham Parks, and others. We know that what those air exchanges are. For your own personal protection and information, we have now finished a study of every single room and office in the district. And we will be posting with our principals and for our teachers digital floor plans of each building, and you'll be able to see what the air exchange rate is in your workspace. So if you are in a workspace that says 0 and it's a classroom, we can get you to 4, we know, with open windows and HEPA filters. If you're in an office with 0, with no windows, we're going to need to talk. Our directions to our staff is that you cannot have more than just yourself in it. If you're in an office with no air exchange, you'll have to meet with people outside at another location. It doesn't mean you can't use it for your own work. I'm sitting in an office right now. It's not an older office, and it has ventilation. But if this were an office that had no ventilation, I would be allowed to work in it. I just wouldn't be allowed to meet. Obviously, the higher the activity that occurs, we want open windows and doors to the outside doors. We're in sort of one of those interesting situations where we have spent years helping to make our buildings more secure because of the previous violent attacks on schools. But right now we know that we're sort of relaxing that a little bit for our own safety against another enemy to our health. Next, please. So we talked a little bit in Massachusetts, the Department of Elementary and Secondary Education has removed the indoor restrictions on close contact. Our desks, you'll see in the classrooms, if you're in a classroom of ours, are no longer spaced. Last year, they were initially spaced 6 feet. And then as we continue to open and the state changed its guidelines, we reduced that to 3 feet. This year, there is no requirement in our classrooms that there be socially distanced for our students. We do, however, require a minimum of 3 feet of distance for the following activities: snacks and meals that we just spoke about, nap time or rest time, and mask must be off. It can be, quite frankly, dangerous for a small child to fall asleep with a mask on. For physical activities, including PE in school, and then in your program, we would want those masks on. Singing, masks should be on, and you should be separated by a minimum of 3 feet, more if it's allowed. And quite frankly, you should be outside whenever you're singing as best as whenever that's possible. And then for us, we have wind instruments and brass instruments. I don't think it's possibly some of you do instrumental programs, but if you do, you must be physically distant there. We are using instrument masks on our woodwinds and brass instruments in our schools. And we would ask you to do the same if you have instrument. I don't think any of you do, but if you do, please do that. Next, please. So one of the things we learned last year, all of us, and I trust that we've all been sort of keeping up on this. If you think back to the early days of the pandemic in March of 2020, we read a lot of extremely frightening stories about how this could spread. At that point in time, surface transmission, the touching of doorknobs, of tables, of toys, of balls, etc., that you all use, were thought to be a conduit. We now know that this virus is very similar to all other viruses.
Wait a second, please.
Can somebody please, or everybody please mute? So we thank you. So for this year, we will continue to have additional custodians on, but we know that surface transmission is limited. That doesn't mean that if you happen to touch a doorknob that somebody just put their hand on that and just sneezed, you couldn't get it. But this virus has a shelf life on surface equivalent to most other medical conditions like the common flu that we get each winter. But we do want you to continue. The kids should constantly wash their hands, soap and water for 20 seconds. We've put, if you're in our buildings, we put banks of, last year we put banks of sinks in areas so kids could line up coming in from recess or going to lunch. They're around the buildings. If you're in one of our buildings, please familiarize yourself, ask the principal or ask the head custodian where the banks of additional sinks. Generally, we put about 5 additional sinks in one spot so kids can line up and they can line up, keep their mask on. They're only going to be near each other for less than a minute, hopefully, and that shouldn't be a problem. The same thing with your program materials, balls, bats, books, toys, puzzles, etc. They can be used, but they should be wiped down frequently. And we're saying between uses, that's sort of us between classes. For you folks, I think you're going to want to do that on a periodic basis, certainly on a daily basis. Next, please. This doesn't necessarily impact you, but for those of you who do have field trips in your programs after school, last year we prohibited field trips for our students. This year we're allowing field trips to take place off-site, and our requirements are that masks must be worn on the bus and all windows must stay open. By the way, the mask on a bus is a state requirement at this point, not just a CPS requirement. So if you do field trips, your students will need to be, and I know I'm talking to you and preaching to those of you who already know this, but masks are required. We are, again, this is a little bit controversial last year with some parents, including some of our staff. They didn't like the fact that kids were on buses when it was 25 degrees with the windows open, but that is what the state requirements call for, and that is certainly what medical and science advisors have told us. Our destinations during the school day can be no more than 1 hour away, and we're asking that they do outdoor destinations. I don't know if some of you may do apple picking. I'm not sure if you have our students long enough to go away, but outdoor field trips are what we're looking at. And again, for CPS and keeping all of our volunteer chaperones must be provided. They must provide us proof of vaccination rather. Again, that is going to be now spreading on to all of our employees starting, quite frankly, tonight with non-union, and we're in discussions with all of our union employees about the requirements for mandated vaccination. We do know that despite our layers of protection in all of our work, that we will have cases. As I said, we had 14 cases this summer in the 6-week summer program. In the CPS, when CPS was involved, I think there was actually a couple of cases after we withdrew from the program or our programs ended. Please make sure your staff and your families know the symptoms. I'm not going to go over them right now. Last year, we sent out weekly and daily reminders to all of our staff about the symptoms. We realize that there is a limit to how much people will look at that. And in some focus group discussions, we made a determination that we're going to continue to post and talk about the symptoms, but not keep sending them to everybody every chance we have. I think you all probably know these symptoms. They should be posted somewhere in your program so that your families know what they are. Again, they'll be getting it from us in mailings and so forth, not on a regular basis, but if anybody has any symptoms, they should not be at work and they should not be in the program. They should check if you have somebody who has a seasonal allergy. You want to check with your school nurse or your own healthcare provider if you're a private third party outside of Cambridge Public Schools. Next, please. As I just said, for our staff, you can't be in if you have even a cold. Last year, we had cases where people came to work with a cold. 2 or 3 days later, they were sick with COVID. And back then, we were quarantining the entire class. We're going to talk a little bit more about that in a minute, but what our plans for this year are. But please do not come in with even a cold. Get tested before you return. So we do know that we'll have cases. And I don't know how many of you were in person last year, but I know some of you were. And the first thing is don't panic. The vast majority of kids who will become symptomatic while at school will turn out not to have COVID or have a mild case of COVID. If somebody gets sick in the afternoon, move that symptomatic child to an otherwise empty area until they can be picked up by a parent and our caregiver. Symptomatic adults must quickly arrange supervision and leave the building. Again, we have had cases in the past where people did not quickly isolate a positive, or at the time they weren't known to be positive, but a symptomatic student or staff. And we ended up with several cases of COVID related to that. Cambridge Public Health they're up to now 4 daily. This information here is about state testing sites as well. But Cambridge Public Health has, I think it's Sunday, Monday, Wednesday, Thursday, I think is the days, but check their site. Anita is nodding yes. That's the best place right now. Rapid antigen tests, when they leave you, are not going to be accepted by public health as proof. They're going to have to get a PCR test from either a private provider or from Cambridge Public Health. Next, please. If someone reports testing positive, you should report immediately to your program leader, and then they should notify Joanne Johnson in this office. We are working with public health to maintain a dashboard of all cases, including cases in your programs in Cambridge Public School buildings. Notify the school principal and nurse at the same time if they're still in the building. And if it's not inside a CPS building, we want you, and this will be in the MOU, to notify the school they attend. We learned last year that the more people know, the safer people are. And we don't want to overstate the danger, but we want people to know that we do not want to be contributing to the spread of COVID to our students, our staff, and equally important to any family members who may be at home. The COVID positive person must self-isolate and must not return to school or your program for at least 10 days. That would be on day 11. People who, if they're asymptomatic or they have a mild case, will oftentimes try to come back before that 10 days is up. They cannot and they must not. For the sake of your staff, your students, and their families, do not allow someone to come back until the 11th day once they've tested positive. By the way, that 10-day is a minimum. We have had many cases, obviously, where the sick individual, the positive individual was symptomatic for well beyond those 10 days. You must be symptom-free for 24 hours before returning, and at a minimum 10 days out. Next, please. So these are the close contact rules in place right now. Close contacts are those identified as having spent 15 minutes cumulatively in a 24-hour period indoors with a person who tested positive for COVID, and they were closer than 3 feet apart at school or closer than 6 feet apart in other settings. This is a difficult thing, obviously, to manage in a program such as the ones that you run. We would ask that you just pay attention to that, try to keep people separate as much as possible, but at the same time, not panic. We want kids to have fun. That's the whole idea here in your programs: fun and socialization and learning. And if there's a constant fear, we know that that's not going to be possible. If this is not an instant contagion, so if a child runs up and gives somebody they haven't seen in 18 months a hug or a squeeze, or somebody that they saw the day before, quietly separate them and remind them of the rules, but don't be overly strenuous on that. So one of the things that we're going to be doing this year, the state has come up with what they call a test and stay program. Last year, when we had a close contact, that close contact had to go out for a minimum of 7 days. If they chose a 7-day quarantine as a close contact, they had to test negative at a community testing site on day 5 and show us that. If they chose not to go to a community testing site on day 5, and therefore be allowed to return after 7 days on day 8, they had to be out for a full 10 days, and they couldn't return until the 11th day. This year, in our schools, we are going to be having a test and stay option, which is going to cut down on the number of quarantine cases and the number of closed classrooms significantly. Can we go to the next slide, please? So when the parent or a caregiver consent, a CPS student who's unvaccinated will not need to quarantine necessarily. It's always possible that public health and Cambridge Public Schools will make a decision in collaboration that they do need to quarantine. But the goal is to not have to quarantine an unvaccinated student or staff member if they agree to participate in a daily rapid antigen testing for a minimum of 5 consecutive days, school days. So now, if we have a direct contact and in working with public health, we are comfortable that direct contact can test each morning when they come to school. We will test that person and that student or adult, and they will not have to. Obviously, this is a state-run program, and we're not going to be able to necessarily test every staff member in person in the programs, but we will try to do as much as we can for your staff. The test is a non-invasive quick nasal swab. I'm going to guess that all of you have had multiple tests. If you worked for us last year, some of you may have been testing twice a week. I know I was testing twice a week last year. If the test is negative, so if you come in, you've been exposed on a Monday, let's just say, and you come in and that student will come to our nurse's office first thing in the morning. They will take a rapid antigen test. If that test is negative, after 15 minutes, they will go to class. If the test is positive on Tuesday morning, they will then be isolated and sent home. So test and stay will significantly reduce student absences and staff absences for us while carefully monitoring for the presence of COVID. This will benefit out of school time providers because positive cases will be identified before students can proceed to your programs. Next, please. So as I said, out of school time staff located in the CPS buildings may be eligible to participate in the test and stay on a schedule that is set by the school nurse. That's a determination that's still in play. We are going to, we've hired for all of our classrooms, for all of our buildings, in addition to a nurse in each building, we've hired a health aide. But our nurses are going to be very busy testing our staff and our students weekly. Last year, we had about half our students in, and we had about half our staff in. This year, we have all of our staff in, all of our students in, so the number of tests that our nurses and aides are going to be doing is going to significantly increase. And we don't know yet what the penalty will be for an unvaccinated staff member. An unvaccinated staff member may face consequences that are yet to be determined. So what we can do, we will do. We need to proof that all out with the state, because this is a state-funded program. Again, it's very important that you notify us of COVID cases or suspected cases that arise after school or that you hear about, including any case contacts, close contacts who will need to quarantine. We know that there's 7 days in a week and we're only with the kids 5 days a week. That means you have about a 2/7 chance of hearing about a close contact situation over a weekend. We need to know all that information. So the good news is vaccinated close contacts do not need to quarantine or to participate in test and stay. That means if you are vaccinated and you're a staff person, or if you're vaccinated and you're a student, I know some of you mostly work with the younger students, but most of you work with younger students, but who are not yet eligible. But if you're vaccinated, you do not need to quarantine or participate in test and stay. Can we go back to that text? However, if you are vaccinated and you are a close contact, you must monitor for symptoms for 14 days from the date of that exposure, and you must get tested at between the 3rd and 5th day of your exposure. If we're able to test you in our building, we will, but I can't guarantee that. That may need to be a community test. And again, Cambridge Public Health is now testing 4 days per week, and employees are eligible even if you're not a Cambridge resident. And you must wear a mask in all indoor public settings. Now, this goes to show you how quickly things change. This document is only about 8 days old, but at that time, there was not an indoor mask requirement in all of schools, and now there is. And in Cambridge is now an indoor mask, or there will be an indoor mask requirement in stores and shops. So that just goes to show you how quickly things can change here. Next, please. So the quarantine rules are very complicated. Again, last year, we had a lot of experience with this. In some cases, we won't be able to test and stay. It may be a complicated case, and public health will work with us and tell us that, no, we need to quarantine. The quarantine period may also be required to last longer than 7 to 10 days. And this is where it gets really, really complicated. If there is COVID in a family with multiple children or with multiple adults, and they cannot fully isolate, they have a much, much longer period. So let's try to keep this as simple as possible. And I apologize if I don't make sense of this, because no matter how many times I try to explain it, I don't quite get it simple enough for the listener. So if Nancy Tauber, who I see on the screen, and I are brother and sister, and we live in the same house, and I come home and I'm sick and I test positive, Nancy will be considered to be, for the first 10 days while I'm isolating, Nancy will be in her own isolation. Her 7-day quarantine won't start until the 7th day, until the 11th day, which means she's in that 10-day period while her sibling is sick and in the same house, and then she starts her quarantine period. So you could be out 17 days. If you have 3 kids, you could be out 24 days. If you have 4 kids, you could be out 31 days. Now, test and stay will help with this, possibly, but most likely they are going to be quarantined. And it could be, you could be out for a while, and we're going to be working with you, and you should carefully work with the public health department. If you have siblings and one sibling is sick in that same house, or an adult in the same house, you must follow those rules. They are harsh. Parents don't like them. Kids don't like them, but those are the public health rules. We also have a document online, What Should I Do, which is a quick reference in addition to the multi-page health and safety manual. Next, please. So our website has all this information, the CPS COVID-19 information. We track all of our cases there. There's a dashboard. You can click on that dashboard at any time, and there will be information about our cases, historical and current, where they were, and the current status. We don't name names, obviously. And one thing I would say that we're going to ask you to contact us with names, because that's necessary to run your program and our programs. But we do not name in Cambridge Public Schools, nor should you be naming to other staff members who the sick child is. So when we have a case in the classroom, or we notify all of our families in that classroom. In fact, we notify all the families in the building, but we do not say whether it's a child or an adult, and we do not certainly name that person. That's important for privacy. Next, please. So for next steps, we're going to need you to return the signed MOU that Kari will get to you. We're going to want to see a copy of your COVID safety procedures. And if your COVID safety procedures are ours, just let us know that. We want you to conduct a health and safety orientation for your staff using this information from the slide deck. Again, if you have one that exceeds this, certainly you should do that as well. We want you to distribute What Should I Do to your staff and families. Stay in touch with us. Last year, we didn't have after-school programs. They were sorely missed by families, and they were sorely missed by the students. And quite frankly, they were sorely missed by the principals and by the educators, because that's where we know the learning day for the student continues. But that means that we had a lot simpler time in tracking this stuff last year. Most important thing I can say to you is you will get used to it. Each time, if you haven't been in person in the past, we opened in waves last year. We opened in October. We opened again in January, which included an expansion. We expanded in the winter, and we expanded again after the April break. So we had a total of 4 openings. And each time we opened, we brought in new students and more staff that hadn't been in. And each time, it was a brand new experience. So by the time April came, a teacher who had been teaching since October was very comfortable. In fact, what we had to do and what we feared with our staff was that they would get used to and complacent and let their guard down. You will get used to it if you haven't been in. We know that, but it's really important that you not let your guard down. And it's important also that adult anxieties get passed on to kids. That's something that we've worked a lot with our principals and our staff last year. We don't want to, it's been a tough year for all of us, a tough year. It's been a tough year and a half, going on 2 years for all of us, especially our kids. So whatever you can do to try to make their experience as stress-free and as anxiety less as possible would be great. So those are what I had to say. I'm sorry it was a little bit long, and hopefully you've learned something, and I'll take any questions that you have right now. And you can, I guess, put those in the chat. Kari, maybe you could be the MC of the, you can be the host of Jeopardy here, and give out the questions.
Sure thing. Thank you, Jim. Couple questions coming in. One, the first one that I've heard is, could we have a link to the slide deck put in the chat? I know there's a lot of different versions of slide decks out there. So Jim or Joanne, I'm not sure which one we want to.
I just put it in the chat.
Oh, perfect. Okay. There's also other resources on the CPS website, which you can always go on to and look for. And those have been updated throughout. So I would definitely browse that as you get closer to the start of your program throughout September. When you see things changing, always come back to the CPS website. We'll also try to be active and share updates with you. There's also a question.
Can I just say one thing, Kari? Also, since Anita is here now, the reason I have her here is so that you could ask the school health nurse manager any questions directly as well.
Great. So let me just read. There's a couple in the chat I'll start with, and whoever can answer them best, please do. Question here: if a staffer has a religious objection to the vaccine, what is CPS's stance?
There will be a religious exemption that we worked out between the lawyers right now. It's not yet finished.
Okay. And then somebody said we don't have access to the link that was shared, so we'll work on that.
I just changed it. It should work now.
Great, perfect. Let's see here. Trying to read, there's another question in here. If anyone has a question you want to ask verbally, now's a good time.
I had a quick question. It's somewhat related to COVID protocols. Sorry, I'll take my mask off. I was wondering about the busing situation to community-based organizations and after schools at the end of the school day. I know that there are some programs that are doing things differently this year, and just wanted to know if anything was changing in that regard, and also if there would be busing for teen programs at all.
Busing, I didn't get the last, but busing for what program?
For teenagers, for middle school or high school.
Nothing is changing right now for our transportation program in the afternoon, just the requirement that they be masked at all times and that the windows be open at all times. We're not talking about expanding our busing program either at the same time. There was a question in there I did notice. Will volunteers be allowed into classrooms to tutor students? Yes, but they will have to be vaccinated. Will OST staff working inside CPS schools be able to participate in regular pool testing? That's our goal. There's some logistical issues there that will have to be worked out. You may not be able to get it when you want to get it. It may, because of the heavy testing schedule. We definitely want you to be tested, though, and we will work with you on that on each school. It may take a couple of days at the beginning of the school to get that worked out with you, but yes, that's our goal. Are you recommending that youth stay in pods or smaller groups to restrict exposure? No, that's not a requirement any longer. Is there a remote learning plan for students who might need to be quarantined? No. The state has made it clear that there is not to be a remote learning program this year. We will be working and work will go home as it would normally happen when a child was sick. But since many students enroll students from multiple schools, what communication systems are in place to help make sure we know about positive cases, close contacts? So that is sort of the underlying goal of this program with communications. We will be working, we had this last year. We have, as you say, multiple students in schools last year, and we had that. And now we know that those multiple students in schools have multiple students in families in after-school programs. It is going to be, it's going to be a challenge, but we will continue to work with you on that. Are all out-of-school time staff required to be vaccinated if they are in school building? And if so, are we required to submit or track that information in some way? So this is sort of all just breaking news. We're working on that now for our own staff. And I can't necessarily comment yet on out-of-school time providers. You're not our employees, and how the school committee and the superintendent will address that. I don't have that just yet, but I do think that there will be growing pressure. We are getting a lot of pressure as well from parents who want to know that the staff that's going to be dealing with their students are vaccinated. Will parents be allowed into school buildings? So one of the things you'll be required to follow, if you'll see it in our safety manual, is parents are not allowed in school buildings without an appointment. You're going to have to arrange for pickup outside, and at that time. We are allowing parents in the building only with an appointment pre-approved by the principal. So in your case, that would have to be pre-approved by your program leader or your site manager. I'll leave that to you.
There's another question on here asking about, will nurses have longer hours to cover after-school programs, or just any other variation on nurses' schedules or coverage or availability?
Anita, you want to take that?
Yeah, I can answer that. So nurses will not have longer hours. They'll work their regular hours only because they're being used probably throughout the city during this time doing flu clinics and so forth. So they won't have longer hours. But they will be there for during the day, and they'll set up a time. I guess you can set up a time. We haven't got a schedule in place right now for pool testing for staff that is in the building, the after school.
Thank you. Any other questions out here?
All right, then. Thank you for your attendance today. Kari has recorded this and can make it available. The deck will be on our website. If you have any questions, please get back. Kari would be the best person to be that filter for questions, and that way he can share it with all of, each question can be shared with all of you so that you're all working on the same page in each response.
Yeah, that's correct. And for folks who are going to be in CPS building spaces or using buses, as just to remind folks at the beginning, at the top, Jim mentioned an MOU. It's also highlighted in the slide deck, and I will be communicating around that. If you happen to get an email about the MOU and you have questions whether or not your program is required to do it, or you have any questions at all, just come right back to me on that, and we'll work with you on a case-by-case basis to figure everything out.
And I do think that our dashboard is something that you should, you as leaders of your programs, our site managers should follow. Click on it every day. It has a couple of factors on it. It will show where the cases are and what's happening, so you can see that. If for some reason we don't get some information to you, number one. Number two, it includes the city's 7-day rolling average, weighted average rather, of cases. And number three, it also shows the percent of cases testing positive. And finally, we track, as the city does, we track COVID in the sewage system, and we post that as well. That last indicator is sort of a leading indicator. If you see that number going up, our experience over the last 18 or 12 months or so that it's been up, you will know that we're going to have more cases about 7 to 10 days out. If you see it going down, you may start to see a decrease in cases. It's an interesting indicator to follow. But it's something that page is something for all of you to watch. It's sort of like a daily newspaper of what's going on in the schools regarding COVID. All right, so I think we can end it up. If you are not vaccinated, please, for your sake, for your family's sake, for our children's sake, get vaccinated. As I said, we're going to be requiring that of all our employees, and that's something that may, in fact, spread out to those in our schools. With that said, I want to wish you all a great year. I know we will have some bumps in the road, but it's just amazing to be able to have all of you back and have all these kids enjoy your programs and have their families benefit from everything that you all do for them. Thanks a lot.
Thank you, everyone, for spending some time, taking this info. And thank you to CPS also for getting this information out for our community of providers. Have a great day, everyone.
Bye-bye.
Have a nice day.
Thank you.
Thank you, everyone.